So with your braces, it is important that you keep your teeth nice and clean. If you allow plaque buildup and tartar around the braces, it can cause little white stains on your teeth that are permanent. So when we take your braces off, these will still be stuck to your teeth and they won't go away. So it's just important to make sure you keep them nice and clean. When you come to your appointments, we make sure we grade your brushing. So if you are missing any spots, we'll go over and show you how to get those. On the back here, you want to make sure you stay away from ice, chewing on pens and pencils, sticky foods like caramels, and then biting into apples, carrots. The apples and carrots you want to cut up into smaller pieces and chew on your back teeth. These things can cause your brackets to break or your wires to bend. If it does happen, you just let your parents know and we'll have you come in and we can fix it for you. We say to try to stay away from carbonated and sugary drinks. If you have one every once in a while, it is okay. Just make sure you rinse with water or brush your teeth if you have a chance to. Crunchy foods like granola bars, you can still have granola bars, but you want to go more for a soft, chewy bar. You don't want to go for the hard, crunchy ones. You do want to stay away from popcorn because the kernels get stuck in your gums and the brackets prevent it from coming up, so it can cause little infections in your gums. Hard candies like mints, you can still have them, but you want to make sure you don't crunch down. You can suck on them. And then gum, you can have sugar-free or sugarless gum. That's okay, it doesn't stick. Crunchy foods like chips, you can still have chips, but you want to stay away from pita chips, kettle chips, those really crunchy ones. So Lay's, Pringles, the Cheeto Puffs, those types of chips are okay. And then picking at your braces. You can touch them and feel and make sure nothing feels loose or sharp, but you don't want to pick at them because you can cause them to break. Foods to avoid, hard and sticky foods. Beef jerky, corn nuts, so they're very tough and hard, so those will break your braces. You do want to stay away from those. French bread, pizza crust, and sandwich rolls. So when you eat a sandwich, you want to go for sliced, softer breads. You don't want to go for heavy, thick rolls. Pizza crust, ideally thinner crust, but if you do have thick crust, just break it up. You can eat pizza regularly, but when it comes to the crust, just kind of tear it into small pieces. And then corn on the cob, meat on the bones, chicken wings, ribs, those types of things, you want to cut it off because if you bite down in the front there, the bone will hit the brackets and can pop them off. Taffy, now and later, sugar daddies, those are high in sugars and also sticky, so you want to stay away from those too. You can still go straight onto the brackets, but you also want to make sure you angle the toothbrush. So you want to go underneath the brackets and also above the brackets. This allows the little brushes to get in between and underneath the wire. Some patients' gums can get a little puffy and swollen, so you just want to make sure you massage your gum line really well and angle the toothbrush. So there's also a travel toothbrush in your kit, which is nice for when you go to school. You can put in your backpack. If you don't get a chance to brush during lunchtime, then you can definitely brush after school. So that's where that third time comes in. Morning, lunchtime, and then nighttime. This is called the interproximal brush, and you can take it and go in between each of the brackets underneath the wire to get any of the food that gets stuck out. Sometimes food will get stuck in the very back, so you can just clean back there. These are reusable. You can just rinse them and let them dry. So this is called the Floss Threader, and you can tie a piece of floss to it. And you can go down or up, whichever is easiest for you. You're gonna go underneath the wire, pull it through. Then you're gonna floss in between those two teeth. You're gonna take it back out and then go to the next one. So it's a little like sewing. You have to go in between each of them, okay? They did come out with something to make it a little bit easier. You'll see a lot of different brands in the store, but you just have to make sure the package says it's for braces or for ortho because it has a skinnier side, a big side and a skinny side. The skinny side will actually fit underneath the wire and you can floss in between. Some spots, like the lower, the teeth are closer together, especially that one area. You won't be able to fit this in between the two spots, so you want to use the regular floss in that area and then this everywhere else. Okay, you don't want to force it in. When you run out of what's in your pack, you usually can find the floss threaders at Target or any pharmacy. The floss threaders, sometimes it's a little tricky to find. They are coming out at the store a little bit more, but Amazon is great. You can order them in bulk. And toothbrush, you can use an electric toothbrush or a regular toothbrush. It's up to you. It's more just all about the angling the toothbrush above and underneath the brackets. So the wax is for your comfort. Sometimes it's just because everything is brand new to your mouth. You can get little sores on the inside of your cheeks or your lips. So you can take a little piece of wax, Sometimes it doesn't stick really well with a lot of saliva, so you can take a tissue and dry your bracket off. And then you stick it to the bracket so it's nice and smooth. Saltwater rinses help a lot, so if you do get little sores on the inside of your mouth, you can take warm water, a teaspoon of salt, and swish it around, okay? And then also in the very back, if the wire starts to poke you, you can take wax and stick it in the back there. And then call us and we'll have you come in and we'll clip the wire for you.
You can expect some level of discomfort for 1 to 7 days after getting your braces on. The discomfort should mostly happen when you bite down. So having liquids and soft foods available will help you get through these first few days. Smoothies and soups are great options. You may take Tylenol or acetaminophen to help ease the discomfort. Ideally, take it 30 minutes before your main meals so that you'll be more comfortable chewing. Avoid taking ibuprofen or other anti-inflammatory drugs as they will slow down tooth movement. For most people, the discomfort starts decreasing after 3 days, and you may move on to other soft foods per your comfort level. Some good initial options are scrambled eggs, mashed potatoes, oatmeal, soft cooked pasta and vegetables, ground meat, flaky type fish, and other soft foods. Your cheeks and lips will also start to adapt to the braces, and you can use wax and warm saltwater rinses to help soothe your mouth during this period. So don't be discouraged, as it is common to experience discomfort during these first few days. Know that you will adjust your braces and that they will eventually feel normal. If you have any questions, please call our office. We're here for you.